water, ice, plate and forks.
Seriously? Service with a smile?
Some things should just be standard. RevVoice has 17 standard calling features. Cut the blue wire. Get RevVoice, save money.
2 days after a cabinet minister dismissed doctors' concerns over national health insurance, the deputy prime minister says they must be addressed. Meanwhile, several stakeholders share their stance on NHI at a town meeting last night. A man's body found in a home wrapped in a garbage bag, plus government set to borrow $33 million. We've got those stories and a lot more coming up tonight. I'm Kyle Joaquin, and NB12 starts now. Topping news tonight, the Consultants Physician Staff Association's position that its doctors will not sign on to national health insurance unless its concerns are met is an issue that has to be addressed, according to Deputy Prime Minister Philip Brave Davis. The association's president has accused government of ignoring and marginalizing the views of local doctors. Davis told NB12 at the House of Assembly today with any initiative that government promotes, it wants full participation from stakeholders, and it would be too divisive not to have them involved in NHI. Dana Smith reports.
The Deputy Prime Minister said although government doesn't necessarily need every doctor to sign on to NHI in order for the government to move ahead with the plan, the stance that the Consultants Physician Staff Association has taken is a concern.
Any initiatives that a government is promoting and implementing, we would want full participation by all stakeholders. So there'll always be a concern that stakeholders would not participate. And so that is an issue that will have to be addressed. The challenge with consultation is that, like almost everything, everyone has a view. And I'm advised that representatives of the body was in contact with the task force, and there have been numerous of exchanges with doctors. Now, unfortunately, maybe all the doctors were not involved, and or their representatives may not have communicated with them as effectively as they ought to. Hence, this air of uncertainty.
The CPSA's president, Dr. Loxley Monroe, had warned this week that if government is not hearing what the association is saying, senior physicians are not going to sign on to NHI. The association's concerns include the model for delivery of primary care and the need for health system strengthening. In the wake of Monroe's comments, National Insurance Minister Shane Gibson declared that government would not be held hostage by a handful of doctors who think the mighty dollar is more important than saving lives, and he charged that there are doctors who support NHI. Davis today reiterated that maintaining doctors are embracing the scheme, though he added whether that's sufficient to carry the whole program through is another matter.
There are many doctors who have embraced the program. I'm sure that those who have been talking with our task force and other persons who have been charged with the responsibility of crafting the program, those doctors would no doubt, I think, become a part of it. Whether that will be sufficient to carry the whole program through is another matter. But again, this is all part of the process to get where we want to go.
When asked if government's NHI implementation scheme can still go according to plan, even without complete buy-in from stakeholders, Davis said he believes it can, although it's better if everyone sees the wisdom and comes on board.
I think NHI can still work, but it's just that you don't wish to, it's too divisive not to have persons who are stakeholders in the delivery of health services not being a part of the whole program. And we would hope that they'll see the wisdom of becoming a part of it.
Reporting for NB12, I'm Dana Smith.
Well, the draft National Health Insurance Bill was revealed in this morning's Nassau Guardian, detailing powers of the NHI Authority, among other things. With professionals of the insurance industry and doctors expressing concern over the government's plan for universal health coverage, the public now has to look into exactly what is being proposed.
Here we are 2 weeks before the implementation, at least of registration, and there is no legislation for NHI.
According to the draft bill, nothing would prevent a person from seeking or maintaining private health insurance coverage. Money approved by Parliament, funds approved by the Minister of Finance, and money from any levies or tax authorized by the bill would go into the NHI fund. As outlined in that draft bill, healthcare providers must provide applicable benefits under the plan and provide any information the NHI authority or an insurance company may require. The NHI plan outlined in the draft bill appears to be consistent with the information released by the government over the last 3 weeks. Also in that draft bill, any administrator or provider no longer wishing to participate in the plan would have to give the NHI authority no less than 90 days written notice and must provide for transition of care of beneficiaries. If he or she chooses, a beneficiary can select a new primary care provider or new approved insurer once a year. Some of the benefits available under the plan would include outpatient primary care, including services of healthcare providers, diagnostic, laboratory, and other medical services, personal preventative services, prescription drugs, and biological and health education. Now, as for contributions, the draft bill proposes that a beneficiary would pay contributions to the plan at such time and as may be determined by the authority and prescribed in regulations by the minister. It says, contributions for certain classes of persons as may be prescribed in regulations shall be paid out of the consolidated fund. Where a beneficiary or his employer, if applicable, fails to pay any contribution due under the plan, such person shall be liable to pay the full cost of any medical services obtained by the beneficiary. Any beneficiary, healthcare provider, and an administrator could face fines for attempting to use funds for purposes other than those prescribed under the bill. Those fines could range from $10,000 for beneficiaries to $200,000 for administrators. Well, nearly 100 people attended a town hall meeting held at the College of the Bahamas' Harry Seymour Library last night to address the many concerns and unanswered questions surrounding the implementation of NHI. Simone Davis was there and filed this report.
During the town hall meeting, Dr. Sands said his concern with NHI is that although it may be very important and much needed, the plan is simply not ready, and despite the haste by the government to get it started, he believes it's just not going to work.
As of the 19th of January, I think that's today, I acknowledge the significant seminal work that has been done, that has been put forth by all the working groups on NHI. I believe that a lot of their work has been made better by the criticism put to them. But the plan that they put together is not ready for prime time. Despite the haste, despite the rush, this ain't the plan that's going to work.
Dr. Sands, along with Medical Association of the Bahamas President Dr. Wesley Francis, Dr. Brennan, and the Bahamas Insurance Brokers Association President Felicia Knowles were panelists at the meeting. Dr. Sands later clarified that the patients would get certain services for free, such as checkups for high blood pressure, diabetes, etc., and receive blood work or basic x-ray or lab test, adding that it is the limit of what is covered in the first phase. However, he said the main issue is that 2 doctors would have to be churning patients out left, right, and center, which would then become a hassle.
When you go to see the doctor for outpatient high blood pressure, diabetes, well baby visit, etc., you go into, and if the patient-centered medical home is a part of the NHI plan, you will be seen, you will be examined, and so on and so forth, and there is no payment due. If that physician determines that you require certain covered blood work or basic x-ray studies or basic lab tests, they would not only be done, but they would be paid for by the practice.
Dr. Francis said his association has major concerns with NHI, and his difficulties with the whole medical home concept is that about 95% of qualified family practice specialists would not be qualified for it. He also said the elephant in the room that can't be ignored is the cost of the entire scheme.
One of the biggest things, and I think the elephant in the room always, is cost. Okay? How are you going to finance it? That's the real discussion that we have to have. We have not really had it. We have to have a discussion about what are you going to offer? That's the benefits package. And I think a lot of people, many of you, don't know what you're going to get with this plan.
While registration for NHI began on Monday, Dr. Brian
said there should be more honest dialogue with the government and more important issues needs to be fleshed out before NHI is fully activated.
When you start talking about a system of universal health coverage, it is really addressing all of those issues. Universal health coverage, when you think about the 4 pillars, speak not just to financing, to which the Bahamas has decided that national health insurance is the financing mechanism for it. But you really start to speak to those things that we know happen to be issues in our system that need to be fixed. And if we continue to ignore it and we don't actually introduce those things, then we'll continue to get the results that we're getting right now. We'll continue to have the suffering that goes on.
Many attendees had serious concerns about NHI, its cost, and what it would mean for their existing health coverage. Some said they were even more confused about NHI than when the meeting started, while others said they support NHI, but they don't think it's fair that they are being forced to be a part of it when they don't even understand it. Reporting for NB12, I'm Simone Davis.
Shifting gears now, a man's body was reportedly found on the bathroom floor of a Pinewood Gardens home last night, wrapped in a garbage bag and duct tape. The discovery was made on Sugar Apple Street, where police had to force their way into the home. CDU Chief Superintendent Paul Rhodes said the victim was the caretaker for the residents and his relatives hadn't heard from him since Saturday. They reported him missing yesterday around 6 p.m.
This evening, police received reports of a missing adult male. The officers accompanied family members to the residence, along with the persons to force their way into the home, and upon entering, found the male lying on the floor in the bathroom with some garbage bags around the body and some tape.
Family has identified the man as 21-year-old Shavano Missick, a native of North Andros. Police are searching for 30-year-old Jason Ian Flowers, also known as Casper, for questioning in connection with this murder. Due to early stages of decomposition, Rhodes said police are unable to determine what injuries the man might have sustained.
The body right now is in the early stages of decomposition, and so it's difficult at this stage to determine the type of injuries caused. And so we would also have to rely on family members in terms of DNA to identify the individual positively.
Police are asking anyone with information to contact them at 919 or Crime Stoppers anonymously at 328-TIPS. When NB12 returns, government to borrow $33 million. We've got the details after the break.